In this video we're going to see how the Picasso light can be used to do gingivectomies on an orthodontic patient. Here we see the preoperative view with the enlarged papillas on the both right and left upper maxillary anterior teeth and the lower mandibular anterior teeth. The tissue is 1 week post-op. You can see here the straight tip that's been initiated being used at 1.2 watts in a pulsed mode. 30 microseconds pulse duration and 30 microsecond pulse interval. No anesthetic was used other than lidocaine gel. This gel was applied and within 30 seconds provides a strong topical anesthetic that lasts for 30 to 60 minutes. You can see that we're using the straight tip in an initiated fashion to remove the bulk of the papilla. We're trying to enlarge the circumference of the gingiva and trying to choose where we're going to cut the gingiva back to. The nice thing about the Picasso straight tips is it really can be used almost like a pen to brush away the tissue. You can see this view at higher mag as we're trying to remove the enlarged papilla that were partially due to poor oral hygiene during the orthodontics and also due to the teeth being brought together with C-chain and the tissue is bunched up in between. The patient's been out of brackets now for a little over a couple weeks, and you can see the tissue is not resolved on its own, and it needs to be refined before final retainers are fabricated after the positioner is completed. Every time that a little bit of debris builds up on the tip, you need to remove this. And you can see in this particular case, we're a little bit slow in removing the debris that is building up on the tip. A wet gauze is all you need, and you can see here that we're not only working on the papilla itself, but we're trying to debulk the papilla, as you can see here, with short brush-like strokes to sort of remove the epithelial layer. In this case, we're working mainly on the mesial and the distal of the lateral incisors to give you an overall view of the procedure. This procedure, all done with topical only, took roughly 15 minutes for the upper and lower anterior teeth. See a clearer view at high mag of what we've accomplished. And here we are at low mag after we've completed all the 6 upper anterior teeth. You can see what a nice result we've been able to obtain, again, without any injections. Here's the immediate post-operative result. This was done today in April. And you can see some higher mag views of the upper anterior teeth. And then we turn our attention to the lower anterior teeth, and we're able again to remove some of the gross amounts of tissue that was creating the bulkiness